This is Mike Carson. I'm the president of the California Tuberculosis Controllers Association. We represent the physician and public health nurse tuberculosis managers and controllers in California's 61 jurisdictions. Our mission is to eliminate the threat of tuberculosis from California through leadership and the development of excellence in tuberculosis prevention and treatment. In 2013, a total of 9,588 new tuberculosis cases were reported in the United States, for a case rate of 3 per 100,000 persons. With continued tuberculosis control activities, TB has been declining in California since 1993. In 2013, tuberculosis reached an all-time low in California. A total of 2,170 cases were reported, a less than 1% decline from 2012. Still, California represents 23% of the active tuberculosis cases diagnosed in the United States, and more cases than the second and third states, Texas and New York combined. Statewide, there are 5.7 cases of tuberculosis per 100,000 persons. To give you some perspective, a new case of tuberculosis is diagnosed every 4 hours in California. A Californian dies with tuberculosis every other day. And a child under 5 years old is diagnosed with tuberculosis every week in California. At the current rate of decline, tuberculosis will not be eliminated for decades, if at all. This year, the Centers for Disease Control and Prevention selected the theme for World TB Day as Find TB, Treat TB, Working Together to Eliminate TB, to highlight that tuberculosis is still a life-threatening problem in the United States, despite a declining number of TB cases. Anyone can get tuberculosis, and our current efforts to find and treat tuberculosis infection and tuberculosis disease are not sufficient. Misdiagnosis of tuberculosis still exists, and healthcare professionals often do not think TB. This year's World TB Day theme encouraged local and state tuberculosis control programs to reach out to their communities to raise awareness about tuberculosis. We don't have to fight tuberculosis alone. We should partner with others who are also caring for these most individuals at risk for tuberculosis, such as persons with HIV infection or diabetes and the homeless. Everyone has a role in ensuring that one day tuberculosis will be eliminated. The California Tuberculosis Controllers Association and our partners are committed to a California free of tuberculosis. Today we honor one of our community partners, the Los Angeles Housing Services Authority. I invite now Michael Stacy, CTCA President-elect, and Peter Kurnt, Los Angeles TB Controller, to the podium.
It's a great pleasure for me to be here today to honor LASA and their contribution. I think, as Mike has said and said so well, and all of us understand so well, the importance of partnership. We cannot begin to address or begin to approach our goal to eliminate TB in California without effective working partnerships. And as very new to TB control, very new TB control among you, with so much more experience, I can't tell you how valuable it has been to have this working relationship with LASA. LASA is the central agency in Los Angeles County to deal with issues related to the homeless. They are HUD funded. They provide support for the housing of the sheltered homeless and the coordination of services throughout LA County. They're being recognized for their leadership, for working with the Department of public health and response to the homeless outbreak, and to the implementation of the guidelines that we issued, the guidelines for shelters, homeless shelters, by inclusion of the core components of the shelter TB prevention guidelines in their contractual language, which was required for every one of their funded shelters. This includes a cough alert protocol, a referral of symptomatic persons to care, to name a designated TB liaison, to ensure TB clearance at shelter entry for referral of services, and TB screening and education annually of all staff and volunteers. Providing annual TB control program sponsored trainings on the shelter guidelines for their executive shelter management staff, including the winter shelter program, which operates between approximately December 1st and March 15th of every year. They have also provided access and training to the use of their case management system, homeless management information system, which has been critical to our effort to ensure that sheltered homeless are screened on an annual basis. It's also enabled us to quickly identify where a homeless person who has TB has been during the time when they have been infectious to others, and also when they may have been exposed, to establish the epidemiologic links between cases, which is so important to our control measures. So it is an honor for me today to present to their executive director, Michael Arnold, this award for achievements of LASA and their ongoing efforts to identify system-level changes to implement the requirements of TB clearance at the shelter entry and to protect residents and staff that work in shelters by referring to caring persons with active TB disease systems. And I see he also has here today his IT lead, Stephen Rocha, who has been a vital partner. And so I welcome you both and thank you very much for your support and cooperation in the past year.
So as you know, every year the CTCA gives an award to a community provider. And so with all of that said, it seems very well deserving to give this year's award to the Los Angeles Housing Services Authority. And it says for outstanding partnership and leadership in the control of tuberculosis in California. And so this is the award that they'll be receiving today. And it's a pleasure to have them here to receive this award.
First of all, thank you all very, very much for this recognition. I think we sort of view what we have done to address the issues that have arisen in Los Angeles County to be just part of the job. I mean, we all work with very vulnerable people, and we know that this is a terrible disease, and we know it's a disease that can be caught and cured, and we all have a role to play in doing that. I also want to call out Dr. Current and his staff in their ability to collaborate, reach out, and I think we've really done an excellent job of both using what we know about our collective systems as well as our technology platforms to really move forward in our ability to get our arms around the issues of tuberculosis in Los Angeles County. So thank you very, very much. I want to thank Stephen Rocha. He has been invaluable. He's our go-to guy when it comes to integrating technology with the needs of this particular initiative. So thank you very much, and keep up the good work. Thank you.
All right, congratulations to LASA. Last but not least, we have one more community